Have you ever stopped to think about your heart health? I'm not asking if you feel any strong pain right now, but if there is any silent sign, one of those that we ignore on a daily basis, which may already be showing that something is not right. Well, that's what we're going to talk about today. I'm going to list for you 7 signs that appear in your body, often in places you least imagine, and that may be related to heart problems. After that, I'm going to talk about 7 symptoms you really feel, that nagging sensation that can be a wake-up call. And in the end, I will leave you with 8 practical guidelines for you to prevent such a problem from appearing in the future. This will be a very detailed conversation, so I suggest you go to the end because I'm sure some information will surprise you. Before we get into the subject, I need to ask you something. If this content is useful to you, share it with the people you care about, especially those who don't have easy access to a doctor or a hospital. You can, with a simple gesture, help save lives. And tell me in the comments, do you already have a cardiac diagnosis or do you suspect you may have it? Where are you writing from? Let's get started. The reality is harsh. Cardiovascular disease is the champion of deaths in Brazil and also worldwide. According to data from the Brazilian Society of Cardiology, here the heart kills about 400,000 people each year. That's a frightening number. Therefore, attention has to be redoubled. I'm going to divide our conversation into 3 blocks. In the first, I will show you 7 signs that you can see in your own body or in the body of someone close to you. They are marks, changes in the skin, nails, eyes, ears, that anyone can observe. In the second block, I will describe 7 symptoms. What you feel, such as tiredness, shortness of breath, pain, and that may be warning you that the heart is not working as it should. And in the third block, I will give the 8 prevention tips that really work, based on scientific evidence, without invention or fads. Let's go to the visible signs, starting with the 7th and going to the 1st. The 7th sign is something that, once you know it, you will start to notice people's ears much more carefully. There is a characteristic called Frank's sign. It was described in the 70s by a researcher who noticed, in his patients with chest pain, the presence of a diagonal fold in the ear. It is as if it were a fold or a crease that crosses the lobe or cartilage. The question that does not want to be silenced: what does the heart have to do with the ear? One of the explanations is that the same factors that attack the walls of the arteries, such as high blood pressure, cholesterol, inflammation, can also weaken the elastic tissue of the ear and produce this fold. Now be careful. Not every person who has this fold has obstruction. Science shows that out of every 100 people with this diagonal crease, about 30 do not have any serious problem, being just a characteristic of natural aging. But 70 people do have some degree of clogging in the coronary arteries or carotid arteries. And there is an important detail. The younger the person, the more likely it is that Frank's sign represents a real disease. For example, someone who is 40 years old and has this fold deserves much more investigation than a person of 80, in which it is more common to be only of age. The sensitivity of this sign is moderate. Out of every 100 people who actually have obstruction in the arteries of the heart, only 40 will have the crease in the ear. Therefore, if your ear is smooth, this is not a guarantee of health. But if she has this fold, especially if you are not yet elderly, it is a reason to talk to a professional. The 6th sign is the loss of hair on the legs. Not that normal shedding that comes with age, but a gradual reduction, which usually starts at the shin and then moves up to the thighs. Why does this happen? Hair follicles need a good supply of oxygen and nutrient-rich blood to produce hair strand. When the arteries of the legs become clogged by fatty plaques, a condition we call peripheral arterial disease, blood flow decreases and the hair begins to thin out until it disappears. In addition to hair loss, the person may notice smoother, almost shiny, cooler skin to the touch, and toenails may grow more slowly. It is important to know that atherosclerosis, which is the deposit of fat in the arteries, is not restricted to a single place in the body. If you have a blocked leg, there's a high chance that other arteries are also compromised, including the coronary arteries, which supply the heart. Unfortunately, most people only find out they have peripheral artery disease when it's already advanced. Of course, losing hair on your legs can also occur for other reasons, such as genetics or constant friction with clothing. But if this is accompanied by cold legs, cramps when walking, or wounds that take time to heal, it is a warning sign. The fifth sign is known as xanthelasma. You may have noticed someone with a yellowish spot or plaque on their eyelid, usually near the inner corner of the eye. That's a deposit of cholesterol under the skin. It doesn't hurt, it doesn't itch, it's usually just an aesthetic issue, but the meaning behind it can be serious. About half of people who develop xanthelasma have dyslipidemia, i.e., high total cholesterol, high LDL, or high triglycerides. However, only 1 in 100 individuals with high cholesterol have these plaques on their eyelids. In other words, it is a rare sign, but when it appears, it increases the risk of events such as heart attack and stroke, even in those who have apparently normal cholesterol. Therefore, if you notice this yellowing on your eyelids, the correct step is to do a blood test to measure your fats, and if necessary, start treatment. The fourth sign is called the senile arch or senile halo. It is a grayish-white ring that forms at the edge of the cornea, often giving the impression that the colored part of the eye is getting lighter. This happens due to cholesterol and lipid deposits in the periphery of the cornea. In most cases, it is a common finding in people over 60 years old. About 60% of the elderly have this arch. After 80, it reaches almost 100%. In the elderly, it is considered normal and does not affect vision, nor does it need treatment. The problem arises when the senile arch appears in younger people, before the age of 45. In this age group, it can be a marker of severe dyslipidemia with extremely high cholesterol or triglycerides, and is associated with an increased risk of early heart disease. So, if you're under 45 and you see this halo in your eye, don't ignore it. The third sign is cyanosis, which is that bluish or purplish color of the skin. Everyone has turned purple with their hands from the cold. That's normal. But if you are in a hot environment and some part of your body, such as your lips, fingers, or toes, turns a bluish hue, it may mean that that region is not receiving well-oxygenated blood. Blood, when it is loaded with oxygen, is bright red. When it is low in oxygen, it tends to be dark blue. Cyanosis can be caused by an arterial blockage, a blocked artery preventing blood from reaching, or by problems with the heart or lungs. For example, in heart failure, the heart cannot pump oxygenated blood with sufficient force. Or in lung diseases such as emphysema, pneumonia, or embolism, gas exchange is impaired. There are also congenital heart diseases, such as tetralogy of Fallot, which from birth cause cyanosis. If you notice a persistent bluish tinge in yourself or someone in the family, especially without being cold, seek medical help. The second sign is ulcers that do not heal, especially on the legs and feet. Not every wound is the same. We have two main types, arterial and venous. Arterial ulcers happen due to lack of blood flow. That is, an obstruction in the artery that irrigates that region. They are usually painful, it hurts a lot, and appear in places such as the tips of the toes, the heels, or the outside of the leg. They usually have a pale or necrotic background and do not bleed easily. People with this condition often experience pain in their calves when walking, what we call lameness, and have cold feet. Venous ulcers, on the other hand, are more common, are linked to varicose veins or venous thrombosis, and usually appear on the inside of the leg above the ankle. Unlike arterial ones, these can bleed and are less painful. An important detail, if the person has neuropathy, as in uncontrolled diabetes, he may not feel pain even in severe arterial ulcers. Therefore, a wound that does not heal within 4 or 6 weeks deserves investigation. It may be the tip of the iceberg of a generalized atherosclerosis, which affects both the legs and the heart. The first sign, and one of the most common, is swelling in the legs, ankles, and feet. This swelling, which doctors call edema, can happen for a variety of reasons, but one of them is a weakened heart. When the heart muscle cannot pump blood efficiently forward, the blood ends up damming up in the veins, and the fluid leaks into the tissues. The result is that the ankle becomes fluffy, and if you squeeze it with your finger for a few seconds, a dimple forms that takes time to disappear. Many people notice that the shoe has tightened, that the sneakers no longer fit as before, and that at the end of the day the swelling is greater, because gravity pulls the liquid down. An interesting sign. If you lie down and elevate your legs above the level of your heart, the swelling decreases or disappears. This is different from edema caused by kidney or liver problems. So if your legs are swollen, especially if you have other risk factors, don't just attribute it to the heat or salt in the food. It could be your heart crying out for help. Now that we've seen the 7 visible signs, let's talk about the 7 symptoms you experience. Things that may be happening to your body and that you may be overseeing as part of aging, but that deserve attention. The first symptom is shortness of breath, technically called dyspnea. It's not that normal tiredness after a steep climb. It's a feeling that you're more out of breath than you should be for the activity you've done. For example, walking a few meters on flat ground, shopping at the supermarket, or climbing a flight of stairs that you used to climb without problems. This disproportionate tiredness is one of the most common ways that the weak heart manifests itself. The second symptom is a persistent cough, especially if it comes with whitish or slightly pink phlegm. This pink or bloody color indicates that there is fluid accumulated in the lungs inside the alveoli. The heart, when it does not pump well, causes blood to be dammed up in the lungs, and this leakage of fluid causes coughing. Many people think it's bronchitis or allergies, but if the cough doesn't improve with common treatments, it's time to think about the heart. The third symptom is shortness of breath that worsens when you lie down. You start to realize that you need more pillows to be able to sleep. 2, 3, even half sitting. Over time, it may reach a point where you can only rest in an armchair. This happens because when lying down, the blood that was in the legs returns in greater quantity to the chest, and a weakened heart cannot cope with this extra volume, causing pulmonary congestion. There is also a classic phenomenon called paroxysmal nocturnal dyspnea. The person wakes up in the middle of the night suffocated with the feeling that they are going to die and needs to sit down or get up to breathe better. If this has happened to you, be sure to tell your doctor. The fourth symptom is generalized weakness, that feeling of tiredness all the time without energy for the simple tasks of daily life. Going to the market, carrying the bags, walking the sidewalk, walking the dog, everything becomes a huge effort. The heart, when it cannot pump enough blood, leaves the muscles and tissues with little oxygen, and here comes this inexplicable exhaustion. The fifth symptom has a strange name, nocturia. It means waking up several times during the night with the urge to urinate. Of course, this can be caused by prostate problems, bladder problems, or diabetes. But when the heart isn't pumping right, the body retains fluid during the day, and at night, when you lie down, that excess goes back into the circulation, and the kidneys have to eliminate it. You get up 3, 4, 5 times. If this pattern has emerged recently, especially along with leg swelling, it is a heart symptom until proven otherwise. The sixth symptom is intermittent claudication. You walk a certain distance, 1 block, 2, and you start to feel a strong pain in your calf, in the potato of your leg. It can be a cramp or a feeling of heaviness. What happens? You stop walking, rest for a few minutes, the pain passes. Walk again, the pain comes back. This is a classic obstruction in the arteries of the legs. The muscle, when exerting, requires more blood and oxygen, but the clogged artery cannot deliver. Here comes the pain. When you stop, demand drops, pain improves. This symptom is strongly associated with atherosclerosis, and again, if you have it in your legs, you can also have it in your heart. The seventh symptom, and perhaps the most dreaded, is chest pain. I'll be very direct. If you are experiencing chest pain, the first hypothesis that should be raised is that of a heart problem. Don't immediately think of gas, muscle, nerve, or anxiety. It can be something banal, but first exclude the serious. Heart pain is usually described as a pressure, a squeeze, a heaviness, or a burning in the center of the chest. It lasts more than a few minutes. It can come and go. It often radiates to the left arm, but it can also go to the neck, jaw, back, both arms, or even the stomach. It is often accompanied by cold sweat, pallor, nausea, or dizziness. If you have this picture, don't wait for it to pass. Seek emergency service. It is not an exaggeration. Now that you know the signs and symptoms, let's get down to business. How to prevent this from happening to you or to those you love. I will give 8 guidelines, all based on science and the experience of those who follow hundreds of cases every day. First, get moving. Get out of the chair, the couch. The human body was made to walk, run, jump, swim. A sedentary lifestyle is one of the worst poisons for the heart. You don't have to kill yourself at the gym. Low-impact activities such as walking 30 minutes a day, biking or swimming already improve blood flow, reduce pressure, and help control weight. Second, if you smoke, stop. There is no middle ground. Cigarettes contain substances that inflame the arteries, damage the walls of the vessels, facilitate the deposit of fat, and increase the risk of heart attack, stroke, sexual impotence, dementia, and a huge list of diseases. Quitting smoking is, by far, one of the most beneficial actions you can take for your health. Third, take care of your weight. Being overweight, especially if it is obesity, overloads the heart in several ways. It increases blood pressure, worsens blood sugar, inflames the body, forces the kidneys, joints, and the venous system. Excess fat is still deposited in the liver and vessels. Losing even 5 to 10% of the weight already brings enormous benefits. Fourth, eat for real. Eat fruits, vegetables, legumes, whole grains, oats, fiber, extra virgin olive oil. Reduce red meat. Avoid sausages, fried foods, stuffed cookies, soft drinks, ultra-processed foods. I'm not talking about a crazy restrictive diet, but about a consistent eating pattern which you can maintain for the rest of your life. Fifth, know your family history. If your parents, siblings, or children had a heart attack, stroke, stenting, heart surgery, or died suddenly before the age of 60, you have a higher risk. This is not a sentence, but it is a sign that you need to do more thorough checkups and start prevention earlier. Sixth, control your cholesterol and your triglycerides. They are not absolute villains, but in excess they become dangerous. Eat oatmeal, soluble fiber, swap saturated fat for unsaturated fat, and if even with diet and exercise you can't get down, don't feel frustrated. 80% of cholesterol is produced by your liver, regardless of what you eat. Drugs exist for this and are safe. Seventh, keep your glucose in check. If you have diabetes or prediabetes, controlling sugar levels drastically reduces cardiovascular complications. The test called glycated hemoglobin should ideally be below 7%. Every point less makes a difference. Eighth and last, press the pressure. Your goal is to keep your blood pressure consistently below 120 by 80. For some older people or those with other diseases, a less aggressive goal, such as below 140 by 90, is already acceptable. The important thing is not to let high blood pressure loose, because it attacks the arteries silently. And of course, if you've identified several of these signs in your body or have been experiencing some of the symptoms I've described, don't stick with this information. Look for a health professional. Take this text. Show what you noticed. Knowledge only becomes protection when it is followed by action. Did you enjoy this conversation? Then share it with anyone you care about. You may be saving a life. And if you want to continue learning, I suggest watching other content about heart attack and high blood pressure. These are topics that connect directly with what we talk about today. Stay with God, take care of yourself, and see you next time. Thank you very much for your attention.